Metatarsalgia causes and treatment. Metatarsalgia is a term used to describe pain in any of the metatarsal regions of the foot. The pain is most often in the forefoot or ball of the foot area that's under the fourth, third, and second metatarsal heads. The pain is also commonly located directly at the first metatarsal head. There are many medical conditions and disease processes that can be responsible for metatarsalgia. It may also be the result of an overuse or traumatic injury causing regional pain. All of these can change the mechanics of the foot or load distribution in the foot, thereby resulting in metatarsalgia. Metatarsalgia symptoms most often have a gradual onset, but may occasionally be immediate, especially following a traumatic injury. Symptoms include pain that may be described as a dull ache, burning, or sharp-shooting pains, pain in one or more metatarsal heads, pain in the ball of the foot, pain that's aggravated during standing, walking, running, or jumping and improves with rest, pain that's aggravated by walking barefoot, tingling or numbness in the toes, tenderness over the affected metatarsal heads, and inflammation in the toes and/or ball of the foot. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the Sinew herbal ice on your foot to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the foot. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your foot with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your foot with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Soak your foot with the Sinew Relaxing Soak to relax muscles and tendons that are in spasm, ease joint pain and stiffness, and improve range of motion. The Sinew Relaxing Soak is particularly useful if you feel restricted mobility in your foot. The soak is used by immersing your foot with the soak in a pot of water. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.